today we'll be talking about back pain. For those that don't know me, my name is Dr. Ben, and I'm passionate about this topic because I've gone through low back pain and know how frustrating it can be, and I've had doctors tell me I should just stop squatting or squat deadlifting or exercising in general. This is before I got into physical therapy school, and it was frustrating. And I also had PTs trying to rehab me that didn't really know how the proper way to squat was or proper way to deadlift looking back. And they didn't really even work out themselves, so it was hard for them to understand what I was trying to get back to and whatnot. And they just said that I had a weaker core, and although I was squatting and stabilizing a pretty substantial amount of weight when I was doing squats, so I knew core probably wasn't actually what to blame looking back now. And once I became a PT, this topic I studied extensively because the story is all too common, and it's something that we see a lot in our practice is low back pain with workouts, with squats, with deadlifts, and whatnot too. So, main thing is today we want to talk about things that you guys can do to decrease low back pain, understand what's going on with that, and whatnot too. I want you guys to comment too if you guys are experiencing low back pain, and if so, how long you've been tolerating or putting it up with for, and because that just gives me an idea, it'll help you guys a little bit better too. So, and again, if you're having low back pain and you've gone to a doctor and they just tell you to rest, this isn't your fault that you're having this low back pain. It's just you haven't had somebody found the right person to kind of educate you and get you to the point that you want to, and make modifications to allow you and understand the exercises and the workouts that you're trying to get back to, and finding the right modification for you and progressing you back into working out. So luckily there's a solution, and it's a solution we've helped hundreds of people find, and that's what I'm going to be sharing with you today. So let's go ahead, and one other thing is I also want to make sure that you guys don't leave here with any questions either. And we're also going to be talking about, for those that aren't having low back pain, we're going to be talking about prevention as well. So if you're not having back pain, that's great. Let's keep it that way. To give you some background information, single leading cause of disability worldwide, the back causes that, or low back pain is leading cause of disability worldwide. Years lived with disability caused by low back pain has increased 54% in just the last 15 years. And this is because of the way we're sitting more, and the way we're working in our workstations. We're less mobile, we're less active, and the body really, especially the spine, responds really well to movement. We need to keep moving that spine, otherwise it gets stiff and we start getting some pain. So 80% of the population will experience back pain at some time in their lives. It's also responsible for $50 billion in healthcare costs each year. All right. So we're going to go over some anatomy, and so the only bones that make up the spine are the vertebrae. All right. They're about this thick. All right. And they stack on top of one another, and in between them there's a disc, and it's full of fluid. And so if you've heard of disc herniations, it's just that this disc between the vertebrae is being kind of smushed, and it's being pushed back usually, and causing a disc herniation. And then we also have nerves that exit the back of the spine. And when that disc is herniated, if it's bad enough, it can push back on the nerves there and cause pain down the back of the leg. Then we also have muscle, very important muscle that makes up. There's a lot of muscle that make up the core, but the most important is the transverse abdominis. The transverse abdominis is like a built-in back brace. Its main role is to help provide stability for the spine. And when that muscle isn't doing its job, other muscles along the spine will start being overworked, and people start having muscle spasms because of it. So a lot of times people are just like, oh, I'm just going to roll out my low back and stretch it, and it just keeps coming back. I hear that all the time. It's because they didn't treat the root issue. For those that have come to my workshops in the past and watched my mobility classes, you know how I keep preaching on to get to the root cause of it. Don't keep just masking the issue and treating the symptoms of just stretching and foam rolling. Okay, that's just treating the symptoms, the root causes, finding these muscle imbalances and understanding why are these muscles getting so tight. Okay, so a lot of times when we see people wearing back braces, I'm usually about 95% of the time against back braces. The only time I will encourage a patient to wear a back brace or think it's appropriate is if they're having excruciating pain and they're unable to do their exercise, they're unable to walk without it, they're unable to do their activities that they want to throughout the day without it on. Because like I said, that transverse abdominis is like a built-in back brace. We just need to strengthen that up, get it to do its job, and then we don't need that back brace. And a lot of times when we wear this back brace, an external back brace, then that transverse abdominis, the one that we have built in, becomes weaker because it's no longer being required to provide any support because that back brace is doing all the work. Okay. And then so there's a lot more anatomy along with it, but that's to understand what's going on with your guys' body. And if you're having low back pain, that's pretty much the gist of it. If you guys have any other questions about anatomy, just let me know. It can get pretty in depth, especially when it relates to the spine. We're gonna move on to types of injuries, right? And again, I don't want you guys like self-diagnosing yourselves with any of these injuries. I'm just gonna give you kind of a better understanding of how do these certain types of injuries present, and if somebody is having this type of pain, they most likely have X diagnosis. But again, don't diagnose. Make sure you get a medical professional to look at it. Whether it's a physical therapist, physician, chiropractor, make sure you get a professional before diagnosing yourself. So one thing we have for a type of injury that's super common, especially in the Bay Area because we sit so much, is herniations of the disc. We talked a little bit about this already. So we have the vertebrae, all right, and they're stacked on top of each other. If you guys look at my low back right now, you guys will notice, you guys see how there's a curvature in the low back? Okay, everybody has that. If you sit up nice and tall, like you should, or stand with good posture, you'll notice that you have that same arch. Okay, that's normal. That's what we want. And when we have that normal stacking and that normal curvature, the weight dispersion of that vertebrae, the bone, is equal all the way around that disc. Because remember, there's a disc, it's full of fluid in between each vertebrae, okay, that are bone. That bone's gonna win every time. And what I mean by that is if we start losing this curvature and we maintain flexion or rounding of the low back like this, if we sit with like bad posture like this, do you guys see how my low back, now I'm like rounding, okay? Now, instead of having that normal curvature of the spine, now we're starting to round out, okay? Now we're like this instead of like this. And so now what happens is we start rounding forward, and now that front part of that front part of the vertebrae is pushing down on that front part of the disc and pushing the disc backwards, okay? Pushing that fluid that's within the disc backwards. And that's how we get disc herniations, and then it can push down on a nerve there, all right? Kelly is asking, what are the best ways to strengthen the transverse abdominis? Great question, Kelly. That's going to be, I'm going to give you one of those exercises today to start making progress and to start strengthening that transverse abdominis. So yeah, we'll be going over that in just a second, and I'll be walking you guys through that and make sure you guys don't have any questions with that too. But good question, super important. So disc herniations can be improved. It can be also seen when people do really heavy squats and do it with improper form. Okay, especially when we get like weight on our backs and we start getting compression, then it can really, and if we're bending forward and not squatting properly, then we're adding that compression and pushing down on that front part of the disc, and it's really going to cause increased risk for disc herniation that way too. All right. Then we have degenerative disc disease. So this is something that we see as we age. So as we age, that disc in between each vertebrae, again, there's fluid in there. That fluid decreases as we age as well. Okay. And so we can get some pinching, like the vertebrae can pinch each other because we don't have as much fluid in there. But a lot of people are like, well, is that even fixable? Yes, it's fixable. It's not reversible, but it's fixable in the sense that you can get by without having pain. You just need to fix the alignment, strengthen up some certain muscles, loosen up some certain muscles, and work on your biomechanical alignment, and then you're out of pain. So it's kind of like osteoarthritis. You know, it's not reversible. What if we change the alignment of different joints? We can offload that painful area and be pain-free. Okay. One thing that's super important is a lot of people read too much into MRIs. All right. Usually the first thing is you go. So this is a traditional way of thinking, and they're starting to get away from this model because it's very cost inefficient. In the sense that, so somebody has low back pain, they go see their physician. The physician, because they barely have any time with that patient, you know, you go and see the physician, tell them they have back pain. They're with you for 5 to 10 minutes. Like, okay, we'll order an MRI, an X-ray. They do an X-ray. Nothing really, you can't really tell. Nothing much will show up on an X-ray unless it's something to do with the bones. Okay, disc isn't going to show up on X-ray, like a muscle strain, tear, anything like that. That won't show up on an X-ray. So a lot of times the X-ray is unremarkable. What I mean by that is there's nothing showing up on the X-ray. So physician, what does he do? Now he orders an MRI, and they get the reports of the MRI, and they tell the patient, oh, you have degenerate, your disc is degenerating, you have slight herniation at L4, L5, and you have a little bit of spinal stenosis, right? And it's all mild cases of this, okay? The thing with that is, now they're thinking about, oh, or what are we going to do next? Do we do injection, medications, surgery, or PT? That's 4 things that a physician can do. All right. If you know you don't want to go the injection, medication, or surgery route, you should have just started with physical therapy in the first place. I'm biased, I'm a physical therapist, right? But I'm just saying, if you know that you don't want to take you want to go the conservative route, really the only conservative route is PT. And back to my point about MRIs, when a patient comes in and tells me that they're having low back pain, I'll ask them if they got an MRI or X-ray. And if they have, I ask them what the results were. But so you know what my thinking process is? The results of the MRI is only about 5 to 10% of my analysis, or what's going to influence my prognosis and my future treatment. Because the reason for that is MRIs aren't that reliable, actually. What I mean, they're good. They will identify things, but the thing is that if you take an X-ray and an MRI on healthy individuals that don't have low back pain, I think it's like 65% or something like that of people that don't have any low back pain will have a mild case of disc herniation, a mild case of stenosis, mild case of arthritic changes occurring within the spine. That's just a normal part of the aging process. It's just like when we age, we get wrinkles. Okay, just like wrinkles showing up on an MRI, like as we age, it's going to happen. It doesn't necessarily mean, there's not a strong correlation between what shows up on an MRI and the pain that somebody's actually experiencing. Okay, so super important. That's one thing that I want you guys to take away from today, is knowing that MRI is not end all be all. There's orthopedic measurements and tests that good physicians, in my opinion, will do. Good physical therapists will do as well, and same thing with chiropractors. We get a lot more from watching how you move, pain, the things that you complain of having pain with, your range of motion, and your strength. That's going to tell me 10 times more than what an MRI is ever going to tell me. All right. So as you can see, I'm super passionate about that, because I've seen so many people go to the physician, get an X-ray, get an MRI, and then the physician's like, oh, you have this, let's do surgery, or let's do injections, let's do medications. And they don't even try and go the conservative route or try physical therapy first. And they put all their eggs in one basket. What I mean by that is the one basket being the MRI results. They've never seen that person squat. They've never seen that person walk. They've never seen that person, how strong their muscles are, their range of motion. They didn't test anything. They're just looking at an MRI. So that's my soapbox for today. Got on a tangent there, but it's super, super important. And I know that can help a lot of people avoid medications, injections, and surgery if they know that. And I'm hoping it becomes more and more common knowledge as the research comes out. So we talked a little bit about spinal stenosis. So spinal stenosis is, if you've seen somebody at the grocery store and they're like leaning over the cart, okay, and they're walking, 9 times out of 10, that person has spinal stenosis. All right. It's kind of creepy that I can just walk into a grocery store and be like, oh, I know they have spinal stenosis, but now you know too. So the reason for that is we have we talked about how as that disc narrows, that's full of fluid. Now our vertebrae are gonna be closer together because there's not that spacing. And so if we stand upright or go into extension, we're gonna get pinching on the back. And remember, there's nerves that pass out the back of the spine, and they can compress down on that nerve, right, and cause pain down the back of their leg or just localized in their back. However, if they run forward or lean over a grocery cart, that opens up the back part or the exit of the spine of those spinal nerves. And so they get pain relief with that, okay? So that's something we see with degenerative disc disease. Then we have muscle spasms. Okay, muscle spasms are, like I mentioned before, is when that transverse abdominis or that built-in back brace isn't doing its job. That's our spine wants stability. That's one of the major joints in our body that wants stability. And if it's not getting stability, it's going to start recruiting other muscles, any and every muscle, to provide that stability, even ones that aren't supposed to. Let me pull up my slides here. All right, so we were talking about heat versus ice and which one's better. So it's really up to, I want you guys to try both and see which one you respond best to. Typically, this is just general, usually what the research shows is when we have an inflammatory response, we want to be using ice. All right, so if we had an acute injury, we just injured our back, we want to be using ice. If we have muscle spasms or tightness, usually heat is going to be more beneficial. And this doesn't just go for the low back, this goes for any muscle joint, the shoulder, knee, or anything like that. If we're having tightness, we want to loosen the muscles up by using heat. Okay, awesome, Kelly. Thanks for the feedback and let me know it's working now. Sorry about the hiccup there. And we already talked about back braces. And then the last part of treatment is if you guys go at it on your own with regards to trying to fix your low back, and that's fine. You can do that you want to do that for maybe a week or two and just see, kind of get a feel for what's going on. But after a week or two, you're not making progress or it's actually getting worse, you need to make sure you seek out a medical professional, whether that's a physical therapist, chiropractic care, or a physician. I'm biased, but I believe that physical therapists should be the first one seen, in the sense of if it's low back pain that's not super severe, like 10 out of 10 pain or something like that, because physical, like I said, typical route is you go see your physician, they do an x-ray, MRI, and spend thousands of dollars getting that MRI, and then that physician's like, oh, okay, just go do physical therapy unless you want to do injections, medications, or surgery. If you know you don't want to do medications, injections, or surgery, you can get an accurate diagnosis from a physical therapist and somebody that's actually going to do a full body initial evaluation and figure out what the root cause is, rather than just getting an expensive MRI that costs, over $1,000 to just tell you when it's really not that accurate in the first place. So seeking out a medical professional is super important. Again, making sure you're not diagnosing yourselves. Okay, so we're going to do some testing to figure out where your guys' core strength is at, and to see if that's causing any problems or contributing to the low back pain. So let me go ahead and get set up here. And so you guys can go ahead and grab a mat. So this is an example of an orthopedic measurement or test that we can do to determine how strong the core is. So you guys can grab your mat. All right, and what we're going to do is, I'm going to turn this way so you guys can see my low back positioning. So you're going to start with your knees bent, all right, and feet flat on the floor. And what you're going to do is you're going to take your hands, you're going to place them underneath your low back, and then what you should feel is kind of like there's like a space, okay, for your hands to go. That's because of that normal arch that everybody should have with their low back that we talked about earlier. All right, you place that underneath your low back, and then what you're doing is you're pushing your low back into your hands, okay? So you're tilting, okay, and you should feel compression on your hands from your low back. From there, you're going to bring your legs up here, straighten them out, and then you're going to slowly lower your legs, okay, and making sure that we keep that compression of our low back that entire time. Okay, we want to maintain that spinal alignment that we had of pushing our low back into our hands, maintain that, raise the legs up, don't lose that, and then lower your leg down, nice and slow, okay? And see if you feel like there's any, if you feel like your low back starts rounding out, or you start decreasing, the pressure is beginning to decrease on your, or the pressure on your hands, that tells me that the core is losing its ability to provide that stability for that spine, okay? And we want to make sure we're breathing out, breathe out, breathe out, breathe out, breathe out, breathe out, okay? While we do this. Again, if you start feeling decreased pressure on your hands as you get closer to the floor, that tells me that the core just isn't quite strong enough to support that, okay? And there could be some core weakness that's contributing to your low back pain. Ideally, we want to be able to get all the way down to the floor without our low back rounding, okay? That's our gold standard. So somebody with low back pain that comes in and they're not able to do that, one way for them to graduate from physical therapy is we want to make sure that they're able to do that and control their legs all the way down without compensation. Okay, so that kind of gives you a glimpse of an orthopedic test that we utilize, right? That tells me a lot more, okay, than an MRI with regards to how strong the core is, because the MRI is not going to tell me how strong somebody's core is. Let me pull up my slides again here, just a second. So if you guys felt like you did a pretty good job on that and didn't have much difficulty, your core's probably fine. It's probably more of the disc that's playing a factor into things, right? So I want to go back to Kelly's original question about how to strengthen the transverse abdominis. So we're just going to start getting in those corrective exercises. So let's start with the transverse abdominis. So luckily, by doing that test that we just did, it's very similar to how we strengthen up the transverse abdominis, because guess what? That test was not testing just the core, it's testing the transverse abdominis, that built-in back brace. So guess how we strengthen it? By doing the exact same thing, where we push our low back into our hands, breathe out, and then relax. Push down your low back in your hands while breathing out, and relax. You may feel your hips kind of come up off the ground. That's okay. All right, so make sure you're pushing low back into the hands, breathing out, and then relaxing. And you may feel yourself kind of shake a little bit if you have a weaker core. And ideally, do about 15 reps. We're going to do about 5 more here. Last one. Good. And relax. Okay. So that's a good foundation to get started. Okay, we got to make sure that we build that strong foundation before we start any of the higher level exercises. That's a good place to start. All right. One thing for people that are having pain, especially when they wake up in the morning or have pain getting out of bed, one thing to start, or they feel like their muscles just really tight, one thing to loosen your muscles up and gradually work your way into being able to get out of bed more comfortably and get you kind of warmed up is what you can do is you just roll on your back. And what you're going to do is you're going to start with small oscillations side to side. Okay? And you can start with smaller, and then as you get more comfortable and more loosened up, then you can start bringing the knees out to the side a little bit further, and then work your way all the way down to the floor. One thing you can do is we want to make sure that we don't let the shoulders lift up. So we're here, and then back. You can line out, kind of go in the T position with your arms. That's going to pin your shoulders down. We're going to get that elongation, that stretching of that low back. And again, we want to do this nice and slow and controlled. Our spine moves in rotation, flexion, and extension, and then also in side bending. Okay, we're working on rotation right now. That posterior pelvic tilt was working, or the exercise we just did for the transverse abdominis, that's moving that spine in flexion and extension. So that's another exercise that's great to do in the morning to kind of get that spine moving. Again, our spine likes movement, but it also likes stability, so we got to find a happy balance with that. And ideally we do about 10 each side, nice and slow and controlled. Okay. Now we're gonna move on to the piriformis. Talk about how I was gonna give you guys a piriformis stretch today to determine if anybody's having pain down the back of the leg, if it may be coming from the piriformis. So this is also a way for us to test, all right? It's also an orthopedic test. So what we're gonna do is we're gonna cross our right leg over our left. We're gonna grab the back side of our knee and pull this right knee to our left shoulder. Okay, we should feel a nice stretch in this glute area. Okay, we're gonna hold this for about 30 seconds. And I want you guys to be mindful of how intense the stretch is on this side, because we're gonna do the same thing on the other side and see what the intensity is like there. And let's say you're having sciatica down the right side of the leg. If we notice that this stretch is a lot more intense on this right side than it is in the left, most likely there's some involvement of the piriformis tightness that's causing some of this sciatic leg pain. Okay, let's go and switch and do the same thing on the other side. And now be mindful of which one feels more tight. If you feel symmetrical, that's great. Okay, that's what we want. If you do have sciatica and you don't notice the difference between side to side, that tells me that it's most likely coming from your low back more than the piriformis. Doesn't completely rule out the piriformis, but it starts narrowing down our thought process about what's going on. About 10 more seconds. All right, and relax. Okay, and again, these should not be painful. None of these exercises should be painful. They should feel pretty good. And if you start having pain or discomfort with them, make sure to stop. All right, do you guys have any questions on any of those exercises at all? Let's see. Okay. So those are the exercises I want you guys to start out with. All right. Prevention, listen to your body. Your body is very intelligent. If you're experiencing pain, it's your body's way of telling you something's not quite right or something needs to be modified. Proper warm-ups and cool-downs. Make sure you're warming up for about 5 to 10 minutes and doing dynamic warm-ups and foam rolling. And then nutrition, make sure you're getting a hydration, decreasing your sugar intake, and then engaging in a variety of exercise. Don't get stuck in always just running or hiking or just stuck in biking or just stuck doing weightlifting. That's my advice is I just like to do strength training. I've been starting to be more mindful about running more, biking, stuff like that, and getting more variety in. So that's something that I'm working on. Physical therapists aren't perfect either, all right? So it's something I'm working on with alongside you guys, okay? So any questions at all before we wrap up here? Well, I wait those to come in. Like I said earlier in the workshop, luckily there is a solution to all this, and it's a solution we've helped hundreds of people find. For example, we had a patient that had been to a doctor and a handful of PTs and chiros that helped a little bit, but didn't help the entirety of it. He said like about 25%. Everyone kept telling him that he just needed to strengthen his core, and I gave him some cookie cutter exercise. He could have just been doing it at home most likely. He then turned, after those didn't work, then he started going down the rabbit hole of YouTube videos and trying to find the best exercise for low back pain. Right? He found us through a workshop just like this and ended up scheduling evaluation with us. And turns out his core was perfectly fine. That wasn't even really an issue. His back wasn't even an issue. The problem was in his hips. And after we did a squat video analysis, we found out his technique was off. 2, his ankles and his hips were super tight. And this was, for those that have come to the squat workshops in the past, you guys know how important it is to have both ankle and hip mobility. If we don't have that ankle and hip mobility, then we start getting compensations from the low back and the knees and start having pain in those areas. So anyways, we started working on, we didn't do any core exercise, we didn't really do anything for the low back. We just started working on mobility for his hips and worked on his strength and also ankle mobility, and he was pain-free in 2 sessions. He continued to work with us for a few more sessions after that, and we increased his squat max by 50 pounds. The reason for that is because we improved the biomechanics, made him more efficient with it. That's the thing too, is we don't want to just get you back to where you were. We want to get you stronger and more efficient with your movements and squatting and working out and doing heavier weights than you ever have before. So I want you guys to kind of envision, you know, what would your life look like if you didn't have this pain and you could exercise and work out the way you wanted to? How different would you feel right now if you could just be the person like I said in the story? So I want to give you guys an opportunity. If we've helped hundreds of people overcome back pain, and over this time of working with people just like you, we've learned that there's a pattern to solving this low back pain. And our time figuring out these patterns led to creating our Bulletproof Low Back program. The program is, we go through a current and previous injury analysis, low back posture and alignment evaluation, put you through a full body biomechanical assessment, and then also do a video analysis of a squat or a deadlift or whatever exercise you're having pain with. And because like I said earlier in the workshop, a lot of times it's not the exercise, it's how somebody's doing the exercise or modifications that, or the incorrect way of doing it. So we do video analysis of that to see if we can clean that up as well. And I know a lot of you guys may be thinking, is I just don't know if this will work for me. I don't know, I don't have the time or money right now, and I don't think physical therapy is what I need to solve my problems, and that's fine. I'm going to turn this back to how long are you willing to tolerate this? And like I said earlier, it's fine to go about this on your own for a week or two and see if you can, if it kind of works itself out, and if it's really not too big of an issue, that's fine. But a lot of cases it doesn't magically go away, and then and I hear it all the time from my patients too after they're done with PT with me, is like, I wish I wouldn't have waited so long to do this. I missed out on so much looking back and never really truly realized, how much pain I was in and how much it was affecting my life. And you're also probably wondering, how much does this cost and whatnot too. So to get the current and previous injury analysis, low back posture and alignment analysis, full body biomechanical assessment, the video analysis, and come up with the prescribed plan of care, is typically $225. However, if you schedule with us today, you'll receive 50% off and get all this for just $112. So if you guys want to take advantage of this, I'll be dropping a link here in the comments, and you guys can just use that. It'll be a link to talk to me or Dr. Colin or Dr. Mike on the phone for 15 minutes to determine, is this something that even warrants physical therapy? Is this something that we can, just point you in the right direction, or send over some quick exercises that will take care of it, or if we need to do more thorough analysis too. So we want to make sure we're not going to waste your guys' time coming in and making sure we can help you first. So filling out that form is beneficial, and then we can talk on the phone and make sure we can help you. So I'll drop that link here shortly. Any other questions? Kelly asks, would you clarify what is the best treatment for spinal stenosis? Great question, Kelly. So that can be, a lot of times it's movement. So one thing that can help is those lower trunk rotations, the ones we did side to side with the knees bent. And then also when we do a posterior pelvic tilt or that exercise to strengthen that transverse abdominis, what it's doing is it's gapping that low back on the back side of the low back and opening up more space for those nerves to exit. So actually the exercise I gave you, the two exercises are going to be a great start to see if that can be of improvement, is doing the lower trunk rotations and then the posterior pelvic tilt. Start with those, see how those go, and see if you're able to get relief with that. A lot of people will get quite a bit of relief just from doing those two exercises. It'll most likely help quite a bit. It just might not help the entirety of it. You might just need, again, there's levels to these exercises. You might just need a progression of this. Would you please email me the exercise from today's session? Absolutely, yeah. Kelly, I've got your email address. I'll send those over here by the end of today and get those to you too. And we'll have the reps and sets and a video description, written description. So if anybody else is wanting the copies of the exercises from today, so you don't have to watch this on replay, just drop your email address below, or you can private message me as well if you don't want anybody to know your email address. Private message me and I'll get that sent over your way as well. I think next week, so I don't know if you guys saw my post, but we're gonna do like a series of this. And we're probably gonna do, I don't know, probably knee or shoulder next time, probably knee. Unless you guys have a specific topic that you guys are wanting to see or would be beneficial, you can drop that in the comments. So if you're watching, so if you guys are having pain in a certain area, just let me know and we can tailor it to that. Kelly says my husband has that in his neck. So spinal stenosis, that can be spinal stenosis. It's again, can be in the low back, can be in the thoracic, can be in that cervical spine or the neck. And so the reason that your husband could be having the pain in his neck is if somebody is sitting with bad posture or poor posture over the years and their shoulders rounded up like this, for me to look up, I got to kind of crank my neck, right? So to do that, okay, if you looked at my vertebrae on an x-ray in this position, what's happening is to have my head look up, I'm kind of crunched like this. There's kind of an arch there. Okay. Now we got the vertebrae kind of pinching on the back. So a lot of times if we can strengthen up the mid back muscles and the neck to provide that support, so we're not kind of like lazy and go here, we can strengthen up everything and get everything in alignment. Now our vertebrae are stacked on top of each other. Now I don't have this extreme extension of the neck. Okay, so a lot of times it's strengthening up the neck, loosening up the muscles in the back, strengthening the mid back, loosening the muscles at the front, and then we start getting more in this position and getting that in the alignment that it needs to get relief. There's a lot of other causes that for stenosis, that's the most common, is what I just described. And again, I haven't done any evaluation or anything on your husband, so take it with a grain of salt, and make sure he gets that looked at. And I'm happy to look at that too. We're doing virtual assessments as well as in person. So if he wants to take advantage of the 50% off the evaluation, I'm happy to hop on a video call or virtual assessment and see what the root cause is and start making progress towards that as well. So hopefully that helps.